Welcome to the Department of Anesthesia and Critical Care at the Massachusetts General Hospital. We'd like to meet you, we'd like to learn about you, and I know you'd like to learn a great deal about us. This is a great hospital, and we train great clinical anesthesiologists here. We'd like to teach you the art and science of clinical anesthesiology. Anesthesiology was born at the MGH. In this room, the Ether Dome, on October 16th, 1846, William T.G. Morton, a Boston dentist, demonstrated before the world that breathing the fumes of sulfurous ether could produce insensibility to pain. Every day when we go to work, we pass the Ether Dome. This beautiful building, designed by Bulfinch, the architect of the Capitol in Washington, is a historical monument for all of medicine. This is the place where the first general anesthetic was given in a public demonstration.
What can I say? The Mass General is the place to do anesthesia. It's one of the finest programs in the world. They take excellent care of us here. They really strive to make it an educational rather than a work-related experience, and it's a heck of a good time. Anesthesia is a well-respected department. We're not an ancillary service to surgery, but a tremendous number of new innovations in the field come from this place, and the surgeons are aware of that and treat us with the same respect that we treat them.
Clear narcotic effect. It's got large tidal volumes.
I would characterize the learning atmosphere as one that's very receptive to people asking questions and getting involved. The staff, you see their names sprinkled all over the literature, and some of the people that you'll ask questions to have actually done some of the pioneer articles and a lot of the things that you'll ask about. And so when you ask a staff member a question about muscle relaxation, this may be a person who's written 50 articles on muscle relaxation and has done a lot of the pioneer work, so you're actually learning from someone who pioneered the whole field of muscle relaxation.
Coming here has been a real thrill as I've gotten to meet some of the world leaders in anesthesia. We have faculty members that are experts in total intravenous anesthetics, low-flow anesthetics for gases. It's just been a thrill to be able to work with these faculty, get to know them one-on-one on a first-name basis, and tap into their skills and their knowledge base whenever you want.
When I came here to interview, I felt an immediate rapport with several people. They were all from widely differing backgrounds, and yet everyone was very down to earth. You get a huge variety of cases that come through the door, and I really like that about this program. I'm allowed to really think like an anesthesiologist, and it's been that way from the start.
The opportunity to do the kind of work, see the patient at the bedside and take this problem to the laboratory and come back with an answer and give an option of therapy to the patient, it's very exciting. And that is basically what attracted me to this program.
Besides all the big tradition and all the other things that probably attract other people, there's a lot of research involved, and I'm very interested in research. And that is an aspect that if you are interested in that, is probably one of the greatest places to be. And the other thing is, when I interview with the residents here, despite what my impressions were from other programs, is that we're having a lot of fun, and this is what the anesthesia is about.
The anesthesia staff on the labor floor get involved in anesthesia for labor and delivery, for cesarean sections, and for all the different operative interventions that surround obstetrics. What's really wonderful about obstetrics is that we develop a relationship with patients that we don't usually get to develop down in the main operating room. We get to be involved in one of the most significant events in the patient's lives. When our residents come up here, they get involved in all of this too. Our residents participate in every case unless we have two things going on at once. And that means they get to do a lot of epidurals and spinals, a little sedation, occasionally a general anesthetic, but they get involved in the patients just like the staff do up here.
These ORs are relatively new because most patients are awake during their operating room experience. A lot of thought's been put into making the ORs a little bit more colorful. And we try to make it a friendly, happy, uplifting kind of environment.
It's fun. It's kind of, there's a circus atmosphere, you know, when you do quads with all those people and all those babies, and it's a lot of fun.
What I'm always amazed at is sort of the diversity of interests and backgrounds that the residents bring to the program. And I think that's one of the things that makes the program very, very compelling and also makes it very stimulating. For us as staff, they're usually very highly motivated, clinically very astute, and very eager to learn. And I find myself learning more as a consequence. And I'm not sure quite often who's teaching who, but it keeps the environment very, very stimulating. We're quite able to tailor the program to the residents' abilities. We have residents who come in who are quite advanced, who have a fair amount of clinical experience, in which case we're able to start them with more advanced cases. Whereas residents who come out of, let's say, internship with maybe less clinical experience, we can still tailor a program for them such that when all is said and done, by the end of 3 years, they're all well-trained, highly skilled anesthesiologists.
Well, one of the great things about coming here, which I really didn't appreciate till later on in my residency, was the extensive alumni list. There are alumni in Japan, in Hawaii, in Anchorage, in Europe, all over, in many of the states that you can call up for guidance, for job opportunities, and that's both in an academic setting and a private practice setting as well.
Research is an important component of our work in anesthesiology at the Mass General Hospital. Our research has been characterized by vision, understanding, and discovering what medicine needs. Some of that research examines the mechanisms of anesthesia, including pain research.
We have established what is clearly one of the foremost pain research laboratories in the United States. And our aim is to understand the pathophysiological mechanisms that operate to produce acute and chronic pain. One of the things we're looking at is the way in which sensory fibers innervate different parts of the central nervous system, in particular the spinal cord, and the changes that occur in these fibers during tissue damage and after nerve damage. A feature of clinical pain is that the nervous system changes dramatically, and that's why this lab is called the Neuroplasticity Research Lab.
In today's News from Medicine,
There has recently been some spectacular work on nitric oxide, a new gas that improves the lungs' function.
It will soon be, if it's proven good, it will soon be unethical not to use nitric oxide.
Senior clinician scientists will guide you to success in anesthesia research.